What were some of the top line findings that you observed? And to that point also, was there anything that stood out or was surprising or even was more notable than others?
Yeah, there's always surprises in AD trials. Luckily for us this time, they were very good surprises. So actually, what we found is that the primary analysis, which is phospho-tau 181, we saw a reduction from baseline to 1 year of 41%. So the population compared to its baseline. And that's a pretty high number. It was statistically significant. And actually, this effect started even at 3 months. So even at the earliest time point of 3 months, we already had 31% reduction of p-tau. And you probably know if the study had a placebo arm, the placebo from all the trials, they either stay stable or they actually increase progressively over a year to 2 years. So this reduction is quite meaningful. And we were happy to see that it starts early and it's quite sustained up to 1 year. And if compared to other agents in the field currently, where you mostly see 24% reduction, the maximum, we obviously have a much higher. It starts early and it's quite a large magnitude. In addition, another important aspect was that the effects on the amyloid species, A-beta-42, of course, is the most toxic. A-beta-40 is the more natural form, but of course, if A-beta-40 aggregates and forms plaque, that's still a bad pathology. So we found that the A-beta-40 and 42 have a biphasic response, meaning initially they seem to increase in plasma, and then over a year of treatment, they actually decrease significantly. It was a p-value that's quite robust, p of 0.004 or p of 0.005. So both A-beta species decrease significantly. And the way we interpret this is that actually ALZ-801 is allowing the brain's natural mechanisms to clear the A-beta species, the oligomers, from the brain to the plasma and keep it sustained as long as we have drug on board. So that was a very important finding.
Yeah, absolutely. And you touched a little bit upon the mechanism of action as well. So why do you feel as though that this drug has promise and therapeutic potential? Talk a little bit about sort of the behind the scenes, what goes on up top.
Okay, so maybe I'll share 2 more points about the effects because it helps build the story of the mechanism of action and how it applies to the system biology of Alzheimer's, if you like. So the other primary imaging biomarker we included was on volumetric MRI. We measure volume of different compartments of the brain, including the hippocampus, which especially in APOE4 carriers is one of the first regions that are affected by the disease. So normally, we understand how in carriers the progression of atrophy, we call it hippocampal atrophy. So in our study, we actually compared the hippocampal atrophy over a year with a very sensitive technique that's a standard in industry, all done by a central imaging group. We compared the reduction with 801 treatment versus the external control arm. What we did is we used the ADNI, it's a big observational study on AD. It's focused on helping drug development. So we matched our population to ADNI. We got the same genotype, same age range, same stage of disease. And when we do very sophisticated modeling to account for any differences in baseline variables, when we do that, we see anywhere from 20 to 24% protection of hippocampus, meaning we decrease the atrophy of the brain volume, the hippocampus, by about 24%. And it was quite significant. So that was the positive surprise because, as you know, very few compounds in development have been able to show effects on brain volume or structure. Actually, some of them go in the wrong direction. In addition, the study, of course, had cognitive outcomes, clinical outcomes. In open label studies, we take them with a grain of salt. Nevertheless, when we compare these results to match them to ADNI using the same technique, we again find significant differences between the treatment arm and the external control. And these were significant effects, highly significant, in fact. The other exciting thing is that these effects on imaging and on cognitive outcomes look very much like our previous data with the old formulation in APOE4 homozygotes, because patients initially show symptomatic benefit or improvement over their own baseline. And actually, even over a year, they remain above baseline. So we've protected their cognition and their hippocampus for a whole year.